Hello, I'd like to take a moment to acknowledge Mental Health Awareness Month for providing you with some helpful tips and nuggets for increasing distress tolerance in our youth. My name is Anita Hughes. I'm a clinical social worker with DC Public Schools. So I now ask that you would please follow me along on this quick roadmap to mental health and emotional wellness as we seek to help our youth combat the many mental health challenges they're faced with on a day-to-day basis. Our topic for today is called Distress. Now what? Building distress tolerance in youth. Our objective for today is one, understanding what distress tolerance is. What are the causes of distress in youth, distress symptoms and triggers in youth, and of course, building distress toolkits for healthy coping. So you ask, what is distress? It is a state of severe anxiety or strain, often brought about by upsetting events. Everyone experiences a wide variety of stress during their lives. How you manage distress is determined by your distress tolerance and your coping skills. Stress is very normal. It's what you do with it that makes the difference. So what are the causes of distress in youth? Of course, this is not an exhaustive list, and there are many other distressors that may be a part of a youth's experience, but these are some typical ones that I want to discuss with you. There are the school demands and frustrations, negative thoughts or feelings about themselves. That's low self-esteem, changes in their bodies, problems with friends and peers at school, unsafe living environment in a neighborhood, separation or divorce of parents, chronic illness or severe problems in the family, grief and loss, romantic relationship challenges, schoolwork and pressure to do well academically, life changes like leaving school, moving to a new home, going to a university, or getting a new job. Too many things to do and feeling unprepared or overwhelmed by the tasks. And of course, there's financial challenges which may include food insecurities and homelessness. So common symptoms of distress. What do we want to look for when we try to determine if a youth is distressed? There may be crying uncontrollably for no apparent reason, withdrawing from previously enjoyed activities, being overly clingy, sweating excessively, having breathing difficulties, fainting, fearful reactions, being afraid, extreme fatigue, verbal and physical aggression, unexplained pains and ailments, having sleeping difficulties, nausea, frequently having to go to the bathroom, the changes in your appetite, eating too much or eating too little, having moodiness or irritability, hypervigilance, always scanning the environment, looking to see if there are perceived dangers. Okay, so we have talked about what distress looks like, the signs and symptoms of it. So let's talk about what is distress tolerance, because that's the key of the day. Distress tolerance allows a person to survive an immediate emotional crisis without making it worse or feeling overwhelmed. It helps a person accept the reality of the situation when they feel out of control because they can't change the situation. It allows, we also call distress tolerance crisis survival skills, which help people cope with their feelings when they don't know exactly what they want or need in the moment. It's short-term coping strategies that help manage emotional pain to avoid destructive behavior. The distress tolerance may significantly worsen during a crisis when people feel helpless and out of control. These skills help a person navigate perceived or actual crises. What are the benefits of distress tolerance skills? Distress tolerance skills can help a person lower the intensity of emotional pain by using emotional regulation, mindfulness, and interpersonal skills. It helps a person to maintain safety in a crisis, helps them keep their mind and body relaxed. When the body is physically relaxed, it's difficult to be emotionally agitated or impulsive. Self-awareness of the mind and body connection is very strong. To calm the mind is to calm the body, to make good decisions. So let's talk about the difference between healthy distress tolerance and low distress tolerance. Healthy distress tolerance, again, allows a person to navigate a perceived or actual crisis in a safe manner. When they're intensely triggered, that person finds healthy ways to cope during that stressful event. Unhealthy or low distress tolerance includes people who have a low distress tolerance tend to become overwhelmed by stressful situations. Sometimes they turn to unhealthy or even destructive ways of coping with these difficult emotions. So we want to think about some of the harmful behaviors associated with low distress tolerance, and that may include cutting, burning, that self-injurious behaviors, running away, using drugs or alcohol, engaging in high-risk sexual behaviors, suicidal ideation or attempts, sabotaging relationships or sabotaging your successes in life. So we've talked about the things that happen with distress and how it looks. Now we want to talk about building our distress toolkits. This is a very important piece in this process. You want to have youth identify pros and cons of the situation to prevent making harmful decisions. Accepting a situation, if it cannot be changed, reduces the pressure to control the situation. Do something that is distracting in the moment, just briefly, just to give your mind a mental break. Improving the moment using imagery and relaxation. Using self-soothing, using our 5 senses to ground yourself. Your hearing, seeing, touching, tasting, smelling. Use good sleep hygiene. Make sure you get good sleep and eat healthy. Maybe have a prayer or spiritual engagement. Try to minimize negative stressors. Again, distraction of playing a game they may use. Use good time management. Have your mindful moments. And remember to breathe, breathe, breathe. Deep breathing is crucial in a crisis. Exercise, relax your body, talk out the problem with trusted individuals. Use a journal. Listen to soothing music. Read a good book. Always ask for help. When you seek support from others, here's some things that you can do. Discuss alternative ways of handling situations. Use appropriate ways to get needs met. Maintain a positive attitude and a positive self-talk. Utilize a safe space when you're distressed. Be aware of physical symptoms of distress and utilize your toolkit. Always identify those support persons. When we do this, there is always the life being a balance between coping and distress. You've got your coping skills, and there's always the demands and the expectations, those distressors, life distressors, and you always want to maintain that balance. Use your coping to manage your stress. And so remember, in closing, when youth feel severe distress, they act irrationally. When youth practice distress tolerance skills, they return to a state of a wise mind where they can make healthier decisions. And that's what we want them to do. Healthy choices, healthy decisions, healthy behavior. So remember, use your distress tools, be happy and be healthy. Thank you for taking this journey with me on emotional wellness and creating it with our youth.